meeting of the St. Paul City Council Policy Committee to order. Good morning, everyone. We have 3 exciting items on our agenda today, and we are going to dive right in. So huge thanks to all of our guest speakers for today, our participants. I know we're all really looking forward to these important conversations. We're going to start by welcoming Ms. Burt, who will be giving us an update on our Recovery Act and Community Reparations Commission. Welcome, Ms. Burt. Thanks for being here.
Okay. Thank you, Council President.
And I think once you get the PowerPoint going, it's probably best to stand in between the 2 mics. I think they'll pick you up better that way.
Okay.
Once it's up and running, yeah.
Okay, to first start off with the labor acknowledgement, which we recite each time at the Commission meeting to help manifest the whole cause of reparatory justice. We acknowledge that much of America, including its culture, economic growth, and development, has been made possible by the forced free labor of enslaved Africans and their descendants, who suffered the horror of the transatlantic slave trade, chattel slavery, Jim Crow segregation, and acts of racism, all culminating into modern-day disparities. We pay homage to these ancestors and ask that they guide the efforts of the Reparations Commission to correct these wrongs for those who are living and those who are yet born. Now, for the sake of the newest council member, Profrosky, I have to practice that still, sorry. I'll quickly like to review some fundamentals and provide a recap of our past activities before highlighting our current and future activities. First off, just to give a revisit to a brief definition of reparations, it is a form of compensation provided to those who have suffered wrongdoings or to their descendants. Reparations can typically consist of monetary payment, but they can also consist of goods, material, or reparatory action. In the United States, for example, reparations have been made to certain groups and proposed for others. Discussion of such topic has involved around reparations to those who have been victims of brutal treatment and racist policies throughout U.S. history, such as Native Americans and African Americans who are descendants of U.S. slavery. Our main enactments starting in January of 2021 was essentially the precursor of the now Reparations Commission, and that was the Reparations Legislative Advisory Committee, and that was the group that essentially established the framework for the commission as we know it today. Following that, of course, was in January of 2023 when the Reparations Commission was first enacted, and then in June of 2023 was the first appointment of the 11 commissioners that now occupy each of the seats on the commission. More recently, February of 2025, we reappointed 3 commissioners who started out with a 1-year term because each of the terms in the beginning are staggered, 1 year, 2 year, 3 year, with the expectation that everyone soon will level out and serve a 3-year term. Again, more recently in May of 2025, thanks to the council, we appointed our newest commissioner, Marquita Kamen, who's essentially replacing a former commissioner who was unable to continue with their entire term of service. Now, referring to the administrative code, the commission is to serve as an advisory body to the mayor and the city council on matters related to repairing the damage caused by public and private systems of racism in the city of St. Paul, which may have resulted in disparities in the following areas of generational wealth, home ownership, healthcare, education, employment, pay, and fairness within the criminal justice system. Again, by the authority of the administrative code, the commission acts in an advisory capacity to the mayor and the city council in all policy and budget related matters pertaining to reparations. And the commission does so through the following activities: creating short, medium, and long-term policy and programmatic recommendations that can create generational and sustainable wealth to descendants of chattel slavery. Each year, we're to establish an annual work plan, and we're also to develop evaluations of city expenditures using quality of life metrics as indicators of progress on the whole matter of reparations, and review and advise city programming and budgets relating to reparations. And we serve as experts on the issue itself, and we encourage and utilize maximum citizen participation in a number of our efforts. Now, to recap our activities starting from the beginning in March, which is when the commission first met, we had to do a lot of housekeeping, and that entailed hiring myself and Janie Vang as staff, electing our officers, of course, approving our monthly schedule, which we meet the fourth Wednesday of the month, and adopting our bylaws and recommending to the City Council a $500 budget request for 2025. Now, looking more currently with where we're at, thanks to the City Council, we were approved $250,000 of that $500,000 request. And with that, we've adopted our work plan and formulated various committees, as you can see before you. One committee is the Reparatory Justice Fund and Slavery Disclosure Redress Ordinance, and that's kind of in a nutshell, looking at the whole matter of slavery and maybe what may be some potential companies who in their very origin had some footing in the whole matter of reparations. Another committee is the Community Listening Session, which has been very instrumental in working on the upcoming community listening sessions we've been advertising. Another committee is focusing on the harm report. Another is looking at some legal questions to address and do some research around. And then another is kind of catch-all, looking at how we may be able to create a glossary, a topic matter as big as this. Looking at providing some other educational information online and doing some archival work to help with some efforts that's going on in the community. And then another committee that was just helping to pull together our budget request. Now, some additional current activities entailed helping our commissioners really, enhance their education on the whole subject matter. And we've been having and inviting guest speakers, helping us to understand the whole city apparatus itself, as well as the matter of reparations, because everyone's on a different spectrum in terms of their knowledge base. We've had one such presenter to come and talk about genealogy. There are some people relative to this movement that really want to trace their ancestry through as far back as slavery, and even as far back to what may be their ethnic lineage and association as far back to Africa. And we've had a guest speaker from Evanston, Illinois, who they were, I guess you could say, the first in the country that instituted a reparations-related policy that was more in alignment with isolating and determining reparations for those Black families that experienced redlining, which is more of a recent impact of racism in the African American community history. And they've had challenges, but they're definitely working through those, and been a good case study throughout the nation, and have been a point of reference point for different activities all over the country. We've had Jay come in, for example, to talk about the council budget process, so we knew how to navigate that. And we had someone come in and talk about the Rondo Inheritance Fund. when I first started, we were getting a lot of questions and confusion about the work of the Reparations Commission and the Rondo Inheritance Fund, and we really kind of had to separate, our two efforts and isolate those. But we had to bone up ourselves on, what that particular initiative of the mayor's office was. And then, of course, learning the procurement and the RFP process. Now, in participating in some local and national reparations efforts, either as participants and in some cases panelists or presenters, we've done presentations locally at a Black Lives Matter national conference held here in the Twin Cities. If any of you know FREC, Facilitating Racial Equity Collaborative, we presented before their Overcoming Racism Reparations in Action Conference. And we've had representation at the American Descendants of Slavery Advocacy Foundation National Summit, as well as First Repair, their national symposium on state and local reparations. And so this has given us a way to really build a lot of networks and build associations within this movement. Additionally, we've had officers and commissioners reappointed. So again, as before, our chair is Traherne Cruz, and our vice chair is Kulia Pringle. And our newest commissioner appointment is Marquita Kamen. And then finally, we recently approved preparations of an RFP to conduct a harm report. Now, upcoming, we are looking to identify some consultants to actually help us with this harm report. And in a nutshell, a harm report is essentially documentation to quantify the historical as well as the ongoing injustices in order to have a basis, for a reparations type of policy platform or programmatic platform. And we're still left to update our work plan for the upcoming rest of the year. We still have a few additional commissioner appointments to make due to some transitions on the commission. And we're looking to make some determinations around a Unity Church is looking at contributing, making some type of financial contribution possibly to the work of the Reparations Commission. So there may be some additional support out there that we can reel in. And working too with County Member Bowie on the Administrative Legislative Advisory Committee work. We understand that's kind of on hold right now, but as soon as that gets to rolling, we're looking to have some representatives from the commission as well as provide some support to that work. And then finally, we have our listening sessions that are coming up. We're looking at conducting a series of those throughout each ward possibly. Ward 7, thank you to Ward 7 Councilmember Johnson. We're collaborating on this first one that's coming up tomorrow, but I want to give all the council members a heads up. We may be tapping your shoulders as well for potential partnership in your ward. And just yesterday, we did some door knocking and flyering, and we're looking forward to having our good first session in the community. So with that, I'll close. I think I'm doing good on time, and I'll open up the floor for any questions you may have. Thank you.
Great, thanks so much for this helpful update. I look to my colleagues to see what questions or comments folks have. Ms. Bowie and then Ms. Johnson.
Thank you, Veronica. I really appreciate getting that overview. It seems like so much work that's been going on, and it's been a pleasure to support this work in community. I just have a question particularly around any future capacity or supports that the commission may need when you are or the commission is approached from like organizations or faith-based organizations who are interested in donating, because I know that was something that we were looking at, particularly of like what are the infrastructure that we need to have in place, so if someone does approach the city or the city council and interested in supporting the Reparative Justice Fund or supporting, outreach and engagement efforts, how we can best support you in receiving those dollars.
Yes. Thank you, Councilmember Bowie. That's a very good question. And I, at the point, I don't have an exact answer for that because this, potential request with Unity Church we're really still trying to figure that out and navigate that and make a determination of what kind of, infrastructure to put in place, not just for that, but as you said, some future, maybe some other future donations. So right now we're just experimenting with that. We are engaged in some meetings with Unity Church to just try and figure that out.
And has there, aside from Unity Church, because I know that was more them be proactive with that relationship that's been built out, but has there been any other efforts of looking at like philanthropy, departments and programs all across the city apply for dollars, whether it's like private philanthropy or state or local? So just wondering if the commission have, began thinking about looking at further investment.
Yes, and I would say, again, thank you for that question. I would say that the Reparatory Justice Fund Committee, for example, has been looking and starting to explore, those kind of potential connections as well. And they, too, for that particular purpose of, trying to create, I guess, for lack of a better word, but a bucket or a fund that potential sources can land in is something that they too are investigating and kind of putting some closer, lenses around that.
Okay. Thank you.
Ms. Johnson.
And Ms. Burt, how are you wanting to get feedback from council members on the harm report preparation for the RFP?
How are we?
How would you like to get council member feedback on the preparation for the RFP on the harm report?
Yeah, well, I think at this point, the commission itself had adopted, we had a harm report committee that did some initial work and put together, a skeletal draft of a RFP for the harm report. And at the moment, myself and Jay are kind of putting some additional structure around that. And so looking at producing an initial draft and circulating that draft to council members for input and feedback.
Okay, thank you.
Mr. Profratsky.
Yeah, thank you, Council President Aker. Very helpful update, I think, on issues like reparations, where it's sometimes difficult to know what the city's role should be versus the state versus federal. It can be difficult to know sort of where to start. And the fact that this is a new body and we're sort of seeing that where to start being laid out, it's always helpful to see sort of what are the first steps. Things like the Inheritance Fund, things like, actual concrete things the city is uniquely positioned to do are, doing this harm report so we can scope out that work even further. It's just helpful to see sort of the scope and how that's starting, because I think in trying to attack like huge intractable challenges like this, it sometimes is difficult to know what our role is at the city level versus county and all of those different things. So appreciate all of and that can sometimes mean it's the sort of strangest, most difficult, broadest starting point when you're doing something like this. So I just want to acknowledge all that's gone into it, and even Councilmember Johnson, doing that first listening session, so we have a chance to have some of this modeled where we all know how to tie in and know how to amplify, because even things like the homeownership gap, things that we know are persistent, long-standing issues rooted in in this. You know, Minnesota has that challenge, but we have that challenge. What can we do to solve it? So just helpful to hear how that conversation has started, but very supportive of the work.
Yeah, and if it's okay, and if I can add to that, that's a very good observation, and I would say too, in our networking around the country, we are seeing various initiatives, and everyone's kind of taking their own special take on this matter. So we're kind of learning from everyone's experimentation, but we're seeing initiatives at the state level, county level, and city levels all across the country. And it is challenging, but we're seeing some of those initiatives have some success.
All right, any other questions or comments from my colleagues? Otherwise, just a huge thank you to you, not only for the presentation, but also the work, and at least speaking for myself, and I suspect for some others here at the table as well, happy to help coordinate a listening session in Ward 2, and I think it's going to be really exciting to see what we hear back from community at this. I really appreciate how the commission has been really focused on that outward engagement from the very beginning. So thank you.
Thank you.
All right, so with that, we will transition to our second item on the agenda, which is an update from St. Paul Ramsey County Public Health, specifically eager to hear about the opioid crisis response and just hear about what's going on. So welcome.
Thank you.
The floor is yours.
Thank you. So good morning, City Council members. Thanks for allowing some time with us today to give you an update on our opioid work. My name is Amy Kieran. I'm your new Public Health Director. Today marks 6 months for me, so thank you for having and trusting me as your Public Health Director. And it's just great to meet all of you, so thank you. I also have Ray, Eden Frank here with me today. And she is a Deputy Director for us within St. Paul Ramsey County Public Health. Sue Mitchell, unfortunately, was not able to be with us today due to unforeseen circumstances, so Ray and I will take it away today. So a few of the things that we'll go over today, and we'll go over them quickly because we know we don't have a lot of time and we want to leave time for questions. We will go over opioid crisis overview, our current overdose data, what we have done thus far with our settlement funds, and then other related programming, and then on to the future. So we don't have to belabor this point, but just really wanted to set the stage. We all know that the opioid epidemic continues to be a national public health crisis. Drug overdose is the leading cause of accidental death in the United States, with opioids being the most common classification of drugs responsible for those overdoses. So the next couple of slides cover the most recent data available. The number of drug overdose deaths in US and Minnesota began to decrease in 2023 for the first time since 2018. Last month, our provisional 2024 data was released showing a continuation of this trend, so that's good. There could be a lot of multiple factors contributing in this trend, including widespread distribution of naloxone, which we have begun to do within Ramsey County, and better access to evidence-based treatment for substance use disorders, or SUD, shifts in the illegal drug supply, a resumption of prevention and response after our COVID pandemic, and continued investments in prevention and response programs. So our state also mirrors the national data at this point. The opioid death rate in Minnesota dropped by 24.4% between 2023 and 2024. This drop marks one of the steepest declines nationwide. So some of those possible reasons are the ones that I just alluded to, but also declining popularity of heroin and probably better treatment and naloxone availability. So Ramsey County data from our Minnesota Department of Health is following the same trend line. So preliminary data for our county from 2024 shows continuation of the downward trend in overdose deaths first seen in 2023. However, at the same time, non-fatal overdoses continue to rise. So we're saving people, but we're still having those overdoses. This likely is the result of more widespread access and the use of naloxone. So the previous data we just looked at was aggregate data, including all ages, races, and genders. If we dig a little deeper, we see huge disparities amongst our communities. So research has shown overdose deaths increasing in Black and Indigenous communities, even as they declined among white people. In Minnesota, overdose death disparities in racial groups are significant, with age-adjusted mortality rates in 2023 indicating that American Indian Minnesotans are 9 times as likely to die of a drug overdose than white Minnesotans. In that same year, Black Minnesotans were 3 times as likely to die of a drug overdose than white Minnesotans. So like I said, really huge disparities amongst our populations. Provisional data from 2024 shows a slight decrease in American Indians overdose deaths from 167 deaths to 155, but an increase in African American overdose deaths from 63 deaths to 73 deaths. So for perspective amongst our population in Ramsey County, African Americans make up about 7% of our population, and American Indians make up about 1.5% of the population. I'm sorry, but that was state data. So 7% and 1.5 across our state. And I'm going to turn it over to Ray.
Thank you, Director Karen. Again, Ray Eden-Frank, I'm Deputy Director at St. Paul Ramsey County Public Health, and really honored to be here today and in front of this historic City Council, so thank you. Well, thank you for welcoming us and having us here. And I'm really interested in the next presentation as well. I didn't know that there was going to be another presentation but specifically about overdose data, so hopefully, we didn't look at your slides. I don't know if you looked at our slides, but hopefully we're in congruence.
It wasn't an accident.
Well, okay, good. And I suppose if I had looked online before I would have seen that, but I didn't. So this is getting into the money and the opioid settlement funds, which again, I don't know, I'm assuming you all know some of this, but we wanted to kind of lay a foundation too, since this is the first time at least we've been in front of the council. I believe St. Paul Ramsey County has been in front of you before, but that was before both Amy and Director Karen and I were in our respective positions. So the Minnesota Attorney General reached a $26 billion agreement with several major opioid manufacturers and distributors. And then more recently, another agreement was reached with Purdue and the Sackler family. It's been in the news quite a bit. That will bring in additional monies into the state that are not reflected on this chart here. So as you may know, 25% of that money stays with the state, and 75% then is distributed to the cities and the counties. And the Minnesota Attorney General's website has more details and specifics if folks are interested. And if you have questions that we can't answer, we can find a lot of that information on that website. Over 26, this reflects the current information that we know, which is that over 26 million will be brought into Ramsey County, to the county, from 2022 to about 2038. There's another about 15.6 billion brought into the larger cities in the county. So the cities with, I don't know if it was above 20,000 or 30,000 the population, were awarded funds separate from the county. So these are the cities: Maplewood, North St. Paul, Roseville, and then of course the city of St. Paul. The recent data that we have is that the St. Paul will be getting about 14 million.
Just pause for 1 second for a question, Ms.
Thank
Bowie.
you, Council President. I just, real quickly, can you talk about what the rounds mean? It says round 1, round 2. Are those years? Are those like months? Just trying to understand.
Yeah, so it was based on the settlements. So the first settlement was with, I wrote this down, but I didn't want to get to it. This was with Johnson & Johnson, Cardinal, McKesson, and AmerisourceBergen. So that was like the first round, and that was the first pot of money. Then there was another settlement with Teva, Allegra, Walgreens, Walmart, and CVS. So that's what the rounds were. This is a little bit of older language that we're actually kind of moving away from, but it was based on the settlements.
Got it. So the rounds are based off of like the entity that was giving the settlements, not the time frame of when
Right.
the money was received. Okay.
Yeah.
Mr. Pravratsky?
Yeah, thanks, Council President Aker. Off of Councilmember Bowie's question, you mentioned 2022 to 2038, is sort of the shape of that disbursement known? Like when, other than the different rounds or the further rounds from Purdue, is sort of the timing and pacing of that disbursement known, or these are just totals and we'll sort of find out later when the dollars flow or how much?
Yeah, there
flows when?
is some of those projections. I'm not familiar. Again, that's
Okay.
some of those details that might be on the Attorney General's website
Okay.
is a good clue to me to like, yeah, I should look at that data and get a little bit more familiar with it
Okay.
as far as like the timing of those disbursements. All that I kind of really know at the top of my head is that they're coming out in staggered amounts. We've seen as of February 25th, the county has received 8.8 million. And I didn't look up the data for the city, but the state the county has received 8.8 million. Approximately 2.2 of that has been spent on our naloxone distribution pilot project and the first round of the opioid response community grants, which I'll get into more detail in the next couple slides. So Ramsey County, with the announcement of this funding, we initiated an opioid response initiative, kind of branded this, purple, and with our, as you can see, this is our opioid response initiative as far as like the branding. So what we've done so far, we launched this initiative. Our vision is really based in prevention to provide education, services, and programs and resources to help reduce substance abuse disorder in the future and reduce opioid-involved deaths and overdoses among our residents. In June 2024, we made available $1 million, which was awarded to 17 community organizations to support one of 5 priority areas: pregnancy, parents, and babies, culturally specific approaches for treatment and recovery, health education, awareness, and outreach focused on prevention. And all this information, while it's not on the slide, it is on our website. Treatment and support for people involved in the justice system, education and engagement with young people. These grants wrapped up in February of this year, of 2025. We will be releasing a new RFP at some point in this year. We also initiated a community distribution for naloxone. We had an online portal at the end of 2023 where people could get on and order naloxone, and we mailed it out. 1,592 naloxone kits were distributed to the community during that period of time. We also do trainings for our county staff and in community and distribute naloxone in that way as well. And we also, in 2024, we funded Justice Point to provide enhanced pretrial case management for participants of Ramsey County Drug Court, or Treatment Court, excuse me. This service is now currently in 2025. It's being funded by the courts, and we've released an RFP, which is actually just closed, for continuation of these services, which will be funded by opioid settlement dollars. We do a lot in the county beyond just what is funded by the opioid settlement funds. We've been doing this work, harm reduction work and targeting injection drug users and people who use drugs for many years, and I'll talk a little bit more on the next couple slides about our syringe exchange program. But this gives a little bit of a picture of some of the other grants and monies that we have coming in. We were awarded our first opioid epidemic response advisory council. You may have heard of ORAC in early 2022. And with this grant, we provided naloxone training to county staff. We really focused on getting out to all of our different departments and staff within the county to provide them with training in naloxone. And we also collaborated with social services, the social services department and corrections, to develop a resource page and a QR code with information for help with arrests, citations, drug use, or mental health concerns. So that has been launched. Then in September of 2023, we were awarded a federal grant from the Substance Abuse and Mental Health Services Administration. And this grant is supporting work in our correctional facilities with justice-involved individuals with opioid use disorders. And then finally, we were awarded a second DHS grant from the Opioid Epidemic Response Services, or ORS. That was in November of 2023, and this project is focused on members of our unhoused population with opioid use disorder and providing naloxone training to community-based organizations We also have a collaborative with the City of Minneapolis. This isn't on here, at the City of Minneapolis Health Department. That was an MDH grant for infrastructure, and we have hired a consultant to look at the feasibility for safer use and safer injection sites, safer recovery sites is what they're called. So we're in the preliminary stages of that, but that's a collaboration with the Minneapolis Health Department, and it's funded by the Minnesota Department of Health. So I mentioned our syringe services program, which is funded by the state, Minnesota Department of Health, HIV prevention funds. So really the target of this is preventing infectious blood-borne disease, so HIV and hepatitis C specifically, for injection drug users. We provide syringe exchange and disposal, naloxone distribution. People can come in and ask for that. So the trainings. We also have fentanyl and xylazine testing strips, wound care, which is a big concern, harm reduction education, the HIV and hepatitis C testing, and then connection to community resources. This is located at 555 Cedar, so a stone's throw from here, and is open for walk-in services. In addition to the on-site syringe exchange program, we have a Clinic 555 care van. This was funded for by Title X, a telehealth grant through Title X, so that was federal dollars a number of years ago. And this is really about bringing their services into community, and so we're at a lot of events in community. We'll be at some Juneteenth events, Pride events, all throughout the summer, providing screening and testing for sexually transmitted diseases, providing safer sex products, and then providing harm reduction supplies, so the naloxone and syringe exchange for safer use and available for providing resources to folks who are looking for additional services. So what's next? I have been very fortunate to be leading this work as of March. I've been with the county for over 10 years. I've been in my position since September of 2023, but just leading this work since March of this year. So extremely excited to be in this space. I have a strong background in this area and a person with lived experience. And so we're now working on staffing up the program. We've hired a supervisor who unfortunately couldn't be with us today so that we can really get the staffing that we need to move forward. We are releasing an RFP to hire a consultant to do strategic planning so we can really hone in on what is our plan and our vision for this work, this body of work. And part of that, we've really heard from community about the need for an opioid advisory council to have some body of community members who have input in the allocation and the prioritization of this funding. So that's in the works, the preparatory works, along with community grants, because we've really heard from our commissioners and from community that community grants were very helpful and they want to continue those. And then we're also supporting our internal programs. We have a lot of things that we're considering doing in very preliminary stages, such as a vending machine, a naloxone vending machine, which is similar to what the City of Minneapolis has initiated, and also some other internal programs. We also recently submitted in collaboration with the Steve Rumbler Hope Foundation. You might be familiar with them. They're also on University Avenue in St. Paul. They're doing a lot of work within the overdose space, and we submitted a collaborative proposal with them to DHS. It's a state grant to look at the utilization of safe recovery sites. So different than our MDH grant, but sort of in the similar vein. And that we just submitted, so we don't know yet. But if we do it, it'll be Steve Rumbler will be holding the grant, and then we would be a sub-grantee. And with that, I will stand for questions.
All right, I see a question from Mr. Pravratsky and Ms. Jost.
Thanks, Council President Naker. Really happy to have this update, particularly now in your sort of pre-staffing time and when you're sort of building out all of this work. I really want to make sure I put in a firm plug for you all to consider, a heavy investment on that response on the Green Line. I ride all the time. I see use. The folks I see using matches the demographic that you were mentioning. These are folks who need support. They need resources. But more to the point, the fact that they're doing it on the train is the same reason people ride the train in the winter or in hot temps in the summer, it's because it is a convenient place to go. It's just a place to be. And that randomness of why they end up being there also means we know where they are. And so I hope that there's a lot of investment from your team and with these settlement funds in reaching folks there, and then also helping improve the usability for, regular people. People like me are going to ride the train either way. I'm perfectly comfortable asking folks not to smoke or moving or whatever, but asking quote unquote regular people to do that is sort of not fair. If they have their kids or they feel unsafe when someone's smoking, that's understandable. Someone like me will ride either way. And we'll reach out directly too, but in particular, there's already a lot of coordination going on between the SBPD, the Office of Neighborhood Safety, and folks who are doing a lot of the proactive community level work anyway, and this I think would be a natural tie-in for that collaboration. So exciting that these funds can hopefully lead to more resources in that space, and it can lead to staffing. Very supportive of the community grants and of culturally competent response, but I hope there's also firm, direct, intentional staffing that's directly on the train much more than we are now.
So thank you for that. I really appreciate it. We are involved with the Safe and Strong Corridor Initiative, and so that would be like with the partners that you mentioned, along with several different Ramsey County departments. Our safety and justice, our public health, and our social services are all involved in that initiative, and actually we've been going out staffing from public health, social services, our appropriate response initiative have been going out on those Wednesday. Actually, I think there's one today. And you've been going out on those as well. So yes, we have been heavily involved in that. We haven't been financially, but staffing, yes, and with our appropriate response initiative, yes. So thank you for that.
And just as a quick follow, I very much appreciate you're already involved in the Safe and Strong. Like, it's very good to hear, and it makes sense, and I'm glad that's happening. And I gave this feedback directly to folks earlier this week too. I appreciate a lot of intention and strategy is going into how to set up that service, and folks with a lot more expertise than me are doing it. So take everything I say with a grain of salt. But it was my appreciation of how it was described was very much based on being at that Dale and University station, which makes sense. I understand it's a hot spot. I personally would very strongly recommend much, much, much more focus on being on the train itself. The stations are good. I'm glad there's officers walking by. I'm glad there's deterrence. I'm glad there's services. But I've seen more recently, but I think I would recommend not just a little more focus on the train itself, much, much more focus on the train itself. Just because, just based as someone who rides the train very consistently. But.
Yeah, and that has been, we've been piloting this for maybe a month or so. And that is one of the components where we're jumping on the train with Metro Transit PD, and then offering people, if they would like to go to treatment, get a ride to treatment right on the spot. We also, as public health responders, are out there, handing out naloxone, harm reduction supplies such as syringes, wound care kits, those type of things. But you're exactly right. So we're just starting, so more to come.
And another area too I want to lift up is the St. Paul Public Libraries. They've reached out to us, and we've had some preliminary conversations with them about how we can support the work that they're doing at the St. Paul Libraries.
Yeah. Great.
Thank you, and thanks for the conversation. Ms. Jost.
Thank you, Council President. I had a question about so is the Settlement Council the same as the Opioid Advisory Council? And then also, what is the timeline for accepting community applications, and what does that process look like?
So the state, so as I said, the state received a portion and is keeping a percentage of the settlement funds. The Opioid Epidemic Response Advisory Council, ORAC, is the state council.
Okay.
And they're doing many of the things that we would be doing at a county level, which is, looking at recommendations for making prioritization and recommendations for funding. But the ORAC is a state body, and what we're looking to form is a county body. And the timeline for that?
Yes.
By the end of 2025.
Okay. Great. Thank you.
Just a couple questions, but one of them, we talked a lot, you talked a lot about sort of addressing the impacts once someone is already using. So harm reduction, we were just having a conversation about usage on Metro Transit, which I strongly agree with Mr. Pravetsky, that for that to continue to be a viable and option of choice for people in our community, we need to make sure that it is safe and feels safe for everyone who uses it. But I'm more curious about preventing use in the first place, because obviously, even if you're not overdosing or fatally overdosing, I think we all agree that using itself is detrimental both to the individual who's using and to society as a whole. So can you talk a little bit about use? I see statistics on overdosing, but is usage skyrocketing, staying stable, going down? Who's using? And then in terms of prevention, what is happening? How much of your budget is going to prevention versus sort of treatment and harm reduction? And what works when it comes to opioid prevention? Is that, I think many of us who grew up in the DARE era, we know that doesn't work, and we're familiar with other drugs. Not personally, but you know what I mean. But this is, I'm just curious if with fentanyl, is it the same? Are there different strategies because it's a different type of addiction? Or if you could just talk a little bit more about prevention.
Mm-hmm. Thank you for bringing that up, because public health is, 99% of our work is prevention work. When we talk about harm reduction strategies, we consider that prevention work. Yes, they're already using, but we are trying to actually save people's lives. And we have started those discussions, and with Safe and Strong also, we have to do that work on that side of things, but I think we really need to figure out the various root causes of why people are choosing to use drugs in the first place, like what you've said. A lot of it, hand in hand, goes in with mental health illness, with that substance use disorder, and that is exactly what we're seeing when we have our residents within our facilities, within our adult detention center, within our corrections. So we do have a team there that's working with people because, I mean, for lack of better terms, we've got them there. They're a captive audience, and so we are looking at doing further work with people before they get released back out into the community, so they have kind of a fighting chance to kick this drug use. But we do need to do much more work on the prevention end, and I think that will come out in our strategic planning. We are very prevention focused, and I think where we sit right now is just really trying to save people from overdoses.
And I think too that is an area of the settlement funds that could go into these community grants. So there's a lot of really good work happening in community, and so for us to be able to support some of that work is one of the things that we'll look at the next round of community grants.
Yeah, and I'll just mention too, what I really like about the Safe and Strong initiative that Metro Transit PD has really led, and Neighborhood House, along with Brooke. I think we know that we, as each individual partners, can't tackle this ourselves. We really need to work hand in hand. And another thing that we've kind of observed out there just recently too is that there's a lot of community groups out there doing things. We're just not very well connected. And so that's going to be part of it, is just trying to figure out what's already existing in our communities and joining up together so we can have a bigger impact.
And just to follow up on my question about use, can you say anything about what's happening in terms of what are we seeing?
I will have to get back to that. I don't have that at the tip of my brain of statistics that I can give you right now, but we can certainly get back to you about that.
Okay, thanks. Ms. Bowie.
Thank you, Council President. I just want to say I appreciate both of the directors giving the presentation, but I also want to share that, especially in Ward 1, the opioid crisis is a crisis. It's at this point, feels like should be declared as an emergency crisis because people are overdosing. People who have businesses and have families are also going to church are faced with the challenges, particularly on Dillon University, Arundel University, Snelling University, Rice Street University. All of that is in Ward 1, and I'm faced with a lot of those complaints and really life or death situations that people are addressing who who haven't received grant funds, but don't even really know much about of how to navigate, whether the county or the state, who have these resources available to actually support their work. I do understand, especially with government processes, it doesn't really work as swiftly as we want it to be. But we have seen like this opioid crisis really plague and weigh down a lot of our services. Having a conversation with our firefighters on university and learning about compassion fatigue and how our firefighters, our law enforcement's been trained to actually address public safety crisis, or to address like someone having a heart attack or a stroke, and constantly being brought to the same group of individuals who are like cycling through our systems. So I not to just burden you, but I think as a council member and as a voice of my constituents, like this has been something that been very, very, very challenging. Yesterday, I was literally in 2 neighborhood groups, and they were like, well, okay, we hear that there's plans for investments for next year. We hear that there's plans for investments later on, but what is the immediate plan? They've also have asked questions around like, if we are moving in a direction of no longer, arresting, people for, whether they're dealing drugs or have possession of drugs, if we aren't, don't have like the staff to actually address that. And I also believe too, like I think we should have a public health approach. I agree with, we need prevention, but also too, we need accountability, and we also need to see that St. Paul is not a place to tolerate this level of activity and behavior. Understanding that people are suffering. So I guess my question particularly, I know this is going to be a long time of collaborating with community. I know Commissioner Moran and I, and also Representative Samakov, has had several meetings at Rondo Library or Hallie Q. Brown. All have been packed, like all have been over 100 people who are trying to collaborate and solve this issue. But even at those meetings, it seems like we're still talking about early stages, and to hear that we have funding that can actually go into the community and address the needs. There are people who are like directly in contact with the people. It would be nice to have you all come back again, particularly around what is the plan of how we can actually engage community about this RFP process. How can the scope of this RFP process be more in line with the immediate need? And I also just share too, like I think yes, like prevention is key, but right now people don't know where to bring people or support them with help who are like literally laid out in front of their doorsteps, are laid out in their office, are laid out on the sidewalks. And if someone's suffering, like people just don't know where to go. And even I looked at the list of like the former grantees, a lot of that was like education, awareness, and I'm familiar with a lot of those organizations, and they do great work. But at the same time, to kind of Councilmember Pravatsky's point, like as a council member, I want to see those organizations present in community. Where are those organizations on? Like, are they on Delhi University? How often? Where are they like having a presence that people actually are clear on? You have been funded and you have been granted to actually do this work. Part of my role too is like providing a lot of education of where people should go, particularly if they are looking for funding. But in the most immediate need, it's like more of a, where is the treatment houses? Where are the shelters? And when you call them, they are packed and they cannot receive more people. it would be nice to also look at, and I'll finish up too, where we can envision further in the future around supportive housing, where we can also look at like group homes and other services that people may not be aware of, but also actually addresses the needs, like community support services. Where is those group homes? Where are those home cares? That's funded from the state level, and how we connect people to that. So I have obviously a lot to say, because I actually talk with people who are suffering, from drug addiction. I also I'm not afraid to go into Wendy's parking lot and ask people of their story and how they got to where they're at. I think we need to see more leadership to where it's like we're not talking high level, but we're also talking directly to the people who are, who we're trying to actually support. So, and I'll just leave with this as well. We have a public safety committee that I'm the chair of, and I want to definitely invite you all to that committee as you are mapping out the advisory council. I think that is an area where I would love to see St. Paul residents and community members have representation, and also have us be part of that conversation around, where are the voices that need to be, on that council to actually support you all in the direction of where funding should go.
I really appreciate it. Thank you for all those words. And I also just want to put in the spaces, we would love to collaborate with the city of St. Paul too, and with, as you know, the city itself is also getting opioid funds, and so we would love to be in collaboration with the work that you're doing as well.
Great. Ms. Yang, and then I think we'll move on to our last presentation.
Thanks, Council President. Well, I first want to say thank you for your presentation and also for all the work that you do. It is life-saving work and very important work, and I look forward to having you all back at the council here. I have a couple of things I want to share just based off of feedback that I've gotten from community members. A few months ago, I got a chance to be on a panel, and County Commissioner Mai Chong and a few other legislators and community leaders that were a part of it too. And two of the things that were mentioned in that town hall meeting was the need for more culturally relevant and responsive treatment programming. Also, that people who were interested in running these types of programming, they were having a lot of challenges just being able to even launch a program. Or I'm not sure if there's some sort of a formal licensing program or licenses that they would need to have for it, but it seems to be a really big barrier, and I would like the opportunity to connect you with those people that we met with who hosted the town hall meeting. And it was an organization called KOOM, and the other thing I want to ask is about the Opioid Advisory Council. Can you talk about what the status of that is? Like right now, are you in the middle of assembling the advisory council and looking to get applications sent in for people who are interested in serving on it, or where are you at in the stage for that? Because I'm happy to funnel people your way too, who I think would be great to serve on it.
Yep, we would love that.
We're in the scoping phase.
Right.
This is number one on my to-do list, and working with Sue Mitchell, the supervisor. And so as far as funneling people to us, we don't have an application process up yet. We will shortly, and certainly funnel people to us, at this time to ask questions, to express interest, because we'd love to start compiling, a list of folks that we can reach back out to.
Great, thank you.
And you maybe picked up on this. We're calling it a reset. We're kind of in a reset mode right now. Kind of looking back at what we've done, kind of evaluating that, see what worked, what didn't work, and then strategic planning moving forward. And all of these comments are so helpful for us.
Yes, and very, very, very helpful. Thank you.
Thanks.
Great. Well, thanks to you again for the presentation, for the work, and to all my colleagues for your thoughtful questions. It sounds like we have a number of follow-ups that I saw you noting down, so we'll look forward to getting that information from you. I know we've had regular updates in the past. I think we had quarterly during COVID, so we'll definitely try to have you back in the future. And then to my colleagues, yes, we have our own St. Paul opioid settlement dollars. My understanding in the past is there hasn't been a lot of coordination, frankly, between the city and the county on those dollars, which is disappointing to me. And so I will follow up with our budget chair and our public safety chair about when it might be appropriate to get an update on those dollars from the city side. But in the meantime, thank you so much.
Yeah, and again, we would love to collaborate, so,
Yes.
you know, reach out. My contact information is on the last slide. Feel free to reach out to me, phone, text, call, email, and I will respond, so thank you.
Thank you very much. And feel free to stick around for the next presentation. As we transition, I just want to comment on something Ms. Bowie said that I really appreciated, which is that government doesn't always move quickly on big problems in particular. But I think this is actually a case where we did move really quickly. I want to give a huge shout out to the St. Paul Fire Department for their receptiveness to a suggestion that Council Vice President Kim and I made after a presentation about a year ago, maybe, in which we were talking about Narcan, we were talking about naloxone. You probably remember this, and we did hear about some of the same folks coming in and out and even being revived multiple times in a day. And the question was, is that the most systemic way of addressing this issue? Is there something else we could do? And since then, the St. Paul Fire Department really answered the call, and I won't do any more to spoil the update. I'll let them talk about that. But with that, welcome up. Thanks for being here.
Council President, council members, thank you very much for the opportunity to come in and speak today about the St. Paul Fire Department, and on behalf of Fire Chief Butch Inks. My name is Steve Sampson, Assistant Chief of EMS, and I have the great honor to speak with you all today. Along with me is Dr. Aaron Burnett. Dr. Burnett is our region's medical director. I know some of you have met him in person as well. Honored that he is here as well. A quick thank you and shout out to the director. Welcome aboard, and I look forward to future collaboration. And Director Rick Shute is also in the audience today as well, representing the department, and appreciate him being in the audience as well. We just have some quick slides to kind of demonstrate where we're at, what we've done. We'll kind of gloss over some of the information, but I really would like this to kind of be an opportunity for you to point some questions our way so that I can either answer or get some traction and some data back and return to you. So on that note, I'll kind of jump right into this. As I mentioned, it was, as you mentioned, Council President, it was approximately about a year ago that we presented initially, and I gave the example of the particular incident where we had the same individual within a 24-hour period, 3 times we saw him, and he was overdosed. He had gone to the hospital, been released, and then subsequently did it 2 additional times. Like this is our reality. This is what the women and men of our department are facing on a daily basis. I know, Council, you came through and did a ride-along recently. We really appreciate you having your eyes opened and exposed to what our folks are seeing, because this is what they're dealing with on a daily basis. So as much as I know all of you are representing your wards, your constituents, you want solutions, you want to address this, so do our folks. So do our folks as well. So I'll jump right into it and just kind of release some of the data here. This is from the OD map for 2024, kind of narrowed in from Ramsey County, obviously, into the city of St. Paul. This is generated on the law enforcement side, particular Ramsey County Sheriff's Office, as well as the St. Paul Police Department. So I do want to give credit there. You kind of see the overlay for this heat map and the signature. We see the highlight there along the green line corridor. The council member mentioned this as well as some of his direct exposures and experiences. It's reflected here from the law enforcement side of the map. Echo Data, that's our in-house kind of data collection platform that we utilize that really combines the fire side of our data collection as well as our EMS response. It combines and merges those two. And this is just kind of a plot map, essentially, of where we are seeing these incidences across the city. Now, there's something that I want to really hone in on, because whether it's someone, you kind of mentioned earlier, council member, about whether there's someone on the front stoop or within a business, sometimes those get called in as a man down, if you will. Like, they don't know what the problem is, and we arrive, assess the individual, and we determine the fact that there's potentially an opioid-related substance on board. So the provider impression really narrows down, because that's the language and the options that our particular individuals have used when documenting their encounters with individuals. So this is a pretty good collection. Now, again, this one kind of reflects 2024 for St. Paul Fire Department specifically. But again, you see the same kind of highlighted areas. Again, the Green Line corridor, the downtown area. But one thing that I want to capture here is that there isn't a single ward, community, neighborhood that doesn't have some kind of representation on this map, unfortunately. And I know, again, as I mentioned, you all see this and hear about this routinely as well. So again, overdose data, 2024 recap, provider impression of overdose. Specifically, we had about 1,500 different cases that were coded as an overdose related. We administered a total of 619 doses, if you will, of Narcan, or naloxone is the other name that you may hear exchanged or interchanged. And then the total documented Narcan administered, excluding prior to arrival. So the prior to arrival is like a resident that may have Narcan of a family member that is suffering from substance use disorder, or it's potentially a law enforcement officer or a librarian, somebody that recognizes someone is potentially overdosed and they administer that Narcan on site prior to the arrival of EMS. So
sorry. Before you keep going,
yes, ma'am.
Maybe you're about to cover it, but the delta between the number of times someone has OD'd and Narcan being administered, which is pretty significant, what would explain that? I assume there's some fatalities, but are there other reasons why you would come upon an overdose and not administer Narcan?
If they've already received the medication prior to us, there's usually around a 60 or 90-second delay before the kick-in of that medication. Or the other side could be that they've already received kind of our maximum doses within our guidelines, and the medical director can obviously speak to that as well. There's a limit that over a certain amount of milligrams, we don't need to administer it anymore because there is no additional medical benefit to it. But Dr. Burnett.
Yeah, I would say our medical treatment of patients that overdose on opiates, we use Narcan to restore their breathing, not to restore a normal level of consciousness. So if the patient's breathing adequately on our paramedics' arrival or on the hospital arrival at that point, we would not administer Narcan. Narcan has the untold side effect of precipitating withdrawal. So when you give it to someone, they often immediately go into withdrawal. So if the patient's breathing okay, we would typically just allow time to clear that opiate out of their system. So I think that's primarily why.
That's helpful. Thank you. Vice President Kim.
So given there's, a lot of community response programs, and you can be trained through Fairview Health, there was a story in the news where I think it was either a staffer or the business owner in St. Paul that administered Narcan themselves. I'm wondering how many of the times that you've responded, like maybe this is in the Delta, where you've shown up and Narcan's already been administered by a community member. Is it very small, or do you see that as an increase of frequency?
Council President, Council Member, anecdotally, we are seeing more and more of it because I think of the assistance of our public agencies that are essentially getting it into the hands of those that need it most. And we're recognizing, we're hearing from business owners, we're hearing from our gas stations, our fast food restaurants that are seeing this, librarians. Like, we are getting them the resources in partnership with the Steve Rumler Hope Network was one of them, as well as Ramsey County. Like, there's initiatives out there to get them into the community. And then on the law enforcement side, they obviously carry it as well. And oftentimes they are geographically in proximity. They're already on the road. They're arriving. They're recognizing what the issue could potentially be, and they're administering that Narcan prior to the arrival of EMS.
Yeah, and just a quick follow-up question then. As someone that has it in my car, I will say, thankfully, I haven't felt like I've needed to administer it. But what would you say to community members that want to be a part of this community first public safety response that might feel hesitant? Like, hearing you say it's not it's a stability measure. Can you just say, if by chance you're wrong or if you're right, can you just tell us a little bit about what it is? In my mind, it's in my most simplistic way, I think it's kind of like a pump of adrenaline to keep them at least with us. Can you tell us, kind of on the record, for community members out there that might be carrying it but are too afraid to use it, even if they've been trained, can you help demystify some of that fear to help promote more rapid responses through our communities?
Yeah, so you should never be afraid to give Narcan. It's perfectly safe. If you have Narcan and someone is not responding appropriately, you can give the Narcan. The worst case scenario is that the patient might go into withdrawal. Withdrawal is miserable, it's horrible, it's painful, but it's not life-threatening. Not breathing is life-threatening. So I would encourage community members, if a patient's not on opiates, there's no effect to Narcan. They get the Narcan and they never even know they received it. So if you're wrong, no harm, no foul. If you're right, you might save a life. And so I would encourage people to never be afraid to give Narcan. And I will just point out our dispatchers through the Ramsey County Emergency Communications Center are asking callers when this comes in, is there any Narcan available? Does anyone have Narcan? And if they do, they're instructing them to give it. We're not waiting for a firm, definitive diagnosis. If it's on the realm of possibilities and there's Narcan available, our dispatchers are telling bystanders to give it. So that's the communication I would give to the community members. There's few things you can do that have a greater chance of saving someone's life than giving them Narcan and starting CPR.
Awesome. I really appreciate that. Thank you so much.
Thank you. Ms. Jost.
Thank you, Council President. The Council Vice President's questions just made me think of, the Narcan that we carry. Are those for adults only? Are those adult dosages of Narcan, or what type of advice is given if we're, encountering young people? Which I remember the last time that you all came to speak with us, there was a lot of talk about how this has been rising in younger folks in our communities.
Yeah, the beauty of Narcan is there is no overdose on Narcan. Okay. So if you give somebody Narcan and they don't need it, again, there's no harm, no foul. Now, if you were giving the auto injectors that are the intranasal ones are 4 milligrams, that may be a large dose for a pediatric patient. But again, even in the worst case scenario, we might tip them into withdrawal from that Narcan. And while as horrible as withdrawal is, when you're in withdrawal, you're breathing, you're not dying. So I would encourage people to really have no concerns. You can give Narcan to pregnant patients. You can give Narcans to infants. You can give Narcan to elderly people. You can give Narcan to anyone. If we were going to think about one case where we could potentially get in trouble, it would be someone, maybe a cancer patient who's on opiates to treat their cancer pain. But again, if they're not breathing from those opiates, whether they're taking them as prescribed and maybe just took an extra dose by mistake, or whether they're taking them recreationally, the common path is not breathing in adults and children, and Narcan will reverse all of that. So there really should be no fear, no hesitation to giving Narcan, even if the patient doesn't need it. If there's no opiates in your system, you'll never know you got it. There's no harm, no foul.
Thank you.
Great. I think we can keep going.
Councilman. So again, into year to date, again, this is up to about Friday of June 6th of last week. But this is kind of the overlay, again, same map, same data collection set on behalf of law enforcement. This is what we're seeing. And as you will notice, between 2024 and 2025, it essentially mirrors the same data set or collection set of what we were seeing on a 2-year basis here.
Ms. Johnson.
Thank you, Council President, and thank you for just being able to kind of bring some of the graphics. I'm a very big fan of just diving into the weeds of the details of the maps that are provided. Can you just say a little bit more about the graphics that you're bringing up? For folks that are digesting it, it can be a little hard to read the key at the bottom left of the screen, and so can you just kind of once again go through exactly what we're looking at here, and what, if you were looking at this map, not really understanding why there's light orange, yellow, darker yellow spots, some red, can you explain that to us in simplistic terms, and then break it down for us and what you're seeing? What do you see when you see this map?
Council President, Councilmember Johnson, absolutely, thank you for the question. So again, this is the law enforcement. This is a state-required map, if you will, of tracking system from the law enforcement angle that is essentially generated out of the BCA. And so they have a mandate across the state that they want to be able to capture the data and the impact that opioids are having on law enforcement specifically. So what you are seeing here is essentially a heat map. So there isn't anything identifying to the patient specifically, anything that's PHI or protected health information, but it gives you an idea of the general area of where we're seeing this. Now, the brighter colors, if you will, just means that we have more dots that are collected within there, and therefore it's being amplified or reflected at a higher level. So that's, again, we can kind of mirror this along the light rail corridor and then the downtown area, which again, I think all of us are aware that this is anecdotally what we're seeing, and then it's demonstrated here on the data side. So total suspected overdoses, and my apologies on the lack of clarity on that, but in the lower left-hand corner on your presentation, or if you can see it on the screen, it states total suspected overdoses being at 755, and then the suspected fentanyl overdoses being at 47, and then naloxone or Narcan, that's how many times it was administered, approximately at 381. So between essentially the Metro Transit PD, Ramsey County Attorney's Office, or I'm sorry, Ramsey County Sheriff's Office, and then the St. Paul Police Department, those are the agencies that would provide the data set or be responsible for collecting and inputting for our particular area.
And I might just add, I think on the data collection form, the checkbox is for overdose call. It doesn't really ask the law enforcement officers to break it down as an opiate or a methamphetamine or a this or that. But we know based off the data that public health showed us as well, we primarily have a fentanyl epidemic, not a methamphetamine epidemic, although that's serious too. So I would suspect that this represents primarily fentanyl calls.
Mm-hmm. Thank you.
Councilor. And then same thing, year to date, approximately the 6 months that we're through here, the provided prevention again of overdose, and we're kind of seeing it overlaid again, the downtown area, and then as well as the Green Line trail across the university corridor.
And if I just might add to this graph, this is the graph I would put a little bit more weight in as the medical director. This is our St. Paul fire paramedics who are giving their medical impression that this is an overdose. So this isn't altered mental status from all the other things that can give you altered mental status. This is the medical impression. So I rely on this graph more than the law enforcement one, but they do show similar data.
And then just some overall data collection points here. The provider impression OD, we're at approximately 776 for 2025 so far. That's about 4.97 calls a day, so almost 5 calls a day where we are responding, and then our folks, regardless of the nature, man down, cardiac arrest, whatever it comes in as, our folks are documenting that it is an overdose-related call. We've administered approximately 260 doses of Narcan, again, up through last Friday. And then the total documented Narcan administration, excluding prior to arrival, is approximately 163.
And so, Chief, just given that we're halfway through the year, it looks like we're tracking with 2024?
Yeah, so in comparison, if we were at about approximately 5 provider impressions of overdose for 2025 so far, we ended up throughout 2024 at 4.36. So we are north of where we were last year. And what I'm unsure of what we can attribute the rise directly to. However, it also sounds as if it was supported by what Ramsey County briefed out on prior to our presentation as well.
Mr. Brzezinski, did you?
Yeah, thanks, Council President Naker. I just want to note, similar to Councilmember Johnson, I really appreciate the visuals, being able to process it this way. One way I'm processing being able to see these incidents is, unfortunately, folks who are used to seeing sort of reporting on public challenges and folks who are under-resourced and folks who need more support are used to seeing sort of, if you map the ACP 50 map, traditionally need for service actually, no matter the topic, unfortunately maps on top of that. Not surprisingly, folks who have been under-resourced are under-resourced. It's jumping out to me like crazy that this map does not look like that. It does not have the same concentration. It is not following the same. And I just want to note, everyone has been saying it, but I'll just say it again, like how different this challenge is compared to other challenges our departments face and our community faces. And of course, the heat map version basically looks like a green line map, and so I just have to name that. You can literally see the stations. I mean, like that's how absurd, like how absurdly based on the green line this challenge is. And so I hate to be such a broken record. I was talking about it and to push so, strongly in the previous presentation for more green line response, but just want to name, like, there's a reason why anytime people talk about taking transit in the Twin Cities, they talk about the green line being uncomfortable or they feel unsafe or whatever. And this is overdose data. And I want to note that I'm sure if there were somehow use data, it would be amplified or whatever. People use and don't OD all the time. Like I see people using constantly. And so just want to note, really acknowledging how much you all are having to grapple with on the response side, purely on the response side. And that's just a huge, as Councilmember Bowie spoke to earlier, being in that ride along and seeing it, that's such a drain and such a stress on you and your staff. And just want to name that that's such a difficulty you all are dealing with. But I really appreciate the reporting just to help us get a perspective on it, because it is one of the rare times where it's sort of not that same mapping of demand, which is really jumping out at me. I can't remember the last time we saw a need document that didn't follow that same pattern, which is just kind of, it just should be noted.
Yeah, Ms. Jost and Ms. Yang, and then I want to make sure, because this data is super helpful, and also I know there is more in terms of the work that you are doing on the Suboxone pilot, so want to hear about that as well. Ms. Jost.
Thank you, Council President. Again, I really appreciate these maps, and I understand that a lot of the concentration is along the Green Line in downtown. I was just wondering if it would be possible for you to share like a full-size version of the maps for Ward 3 and I don't know, maybe some of Ward 7. They're kind of cut off at the bottom, and so I'd really appreciate that. And understanding that, you know, again, maybe the focus isn't there, but it would just be interesting to see that. And I'm, you know, curious when I see, you know, we all, when we're looking at these maps, see exactly where these locations are in our community. So I'm like, okay, well, that's where this Walgreens is, that's where this is, and so I'd be interested in seeing that if you'd be able to provide it.
Council President, Council Member, absolutely. That's something we can certainly follow up with, and it might be beneficial if we just kind of break it down per ward to the best of our abilities. And I can share that with each council member if you're amenable to that.
Yeah, that would be great. Thank you so much.
Absolutely, ma'am. Thank you.
Ms. Yang.
Thanks, Council President. Well, I also want to say thank you all for your work as well, and Assistant Chief Sampson. I still remember when you came and presented on this the last time. I want to appreciate you because I think you have had really great communication with the council here and been really receptive to input that we've shared and feedback to, and going out there trying to make those suggestions come to life. So I again appreciate you for your work. I was wondering, like, especially since we've been having a lot of conversations about efforts at the city and also county too, if any of our presenters today, you all are able to share about what sort of funding or efforts we see coming from the current federal administration at all. Like I feel like I don't often hear about that, and so I'm very curious to see if there's any boost in support from our federal government around this.
Well, that's very timely, thank you. We have a grant that we submitted in February, a completed grant for $1.4 million for the Center for Disease Control and Prevention, and we've not heard anything on that. So that, I think, was a very competitive grant. There were three parties: the Fire Department, Regents Hospital, and the University of Minnesota School of Public Health, so it was very multidisciplinary. So we have that grant. It's sitting at the CDC. It's my understanding the prevention division of the CDC has had significant layoffs, so I don't know if that grant is active still, if that funding is active still, but that is completed and submitted. That was one of the things I was going to speak to. I don't know if you have any more.
No, that is something that we are anxiously awaiting follow-up word on, ma'am. And other than that, the opioid settlement funds as well that have been directed to the city, we anticipate the ability to kind of collaboratively across all city departments enter into some kind of a focused effort on essentially what you were seeing on the map. Like there's essentially three components, right? There's the recognition that there's an issue, and we know that we have the data to support that. And then there's the enforcement side, and then there's also the assistance side. We have those that are impacted by substance use disorder. They're addicted. This physically changes a human being. This physically changes them. It's a medical condition, and we have to treat it that way. And so, Councilmember Bowie mentioned the compassion fatigue. It's compassion fatigue because we don't have options besides responding to them. And it's frustrating to see the hurt and the harm that our community is going through consistently when we are losing people and we're losing valued years of life. It's hard. It's really, really hard. And that's hard for our folks to put up a defense against and continue to respond and see this impact another brother, sister, mom, partner, whatever it is. It's really, really hard. So I was literally, before this meeting, I was speaking with a city employee, and she asked what I was doing here, and we brought it up and taught her for a second, and then she kind of went into her story. She lost a nephew to overdose. Like, this doesn't not impact any one of us. We all have those stories, and I know you all do, and you're engaging with your constituents that see the same thing. So I don't want to say it's a passion project. I want resources for our community, and I want resources for our people that are suffering, and I want resources for the women and men of our department that are responding. So, off the soapbox, but yeah, just a little plug there.
Yeah, Vice President Kim, and then get back on the soapbox. Tell us about Suboxone and what kind of money you need for it.
Yes, ma'am.
I will ask my question after you speak to that.
Absolutely, sounds really good. So if I may, I'm going to back up one slide if possible. This one, I'll just bring this one up because the color metrics. We see that we have a problem. I think all of us acknowledge that. And as we deployed the Suboxone program approximately a year ago, we delivered our first dose. Essentially, we went live on our apparatus in about late October, and we delivered our first dose at the beginning of November, essentially. We have since delivered, just most recently, we delivered our third dose of Suboxone to a resident here coming out of a recent event that took place in the city of St. Paul. And so we've successfully administered 3 doses, which doesn't sound like a lot, but we've engaged and assessed upwards of 60 individuals that essentially qualified for the medication. So this is something that prior to October of last year, we didn't have as an option. So even though we've only successfully administered 3 doses, that means that's 3 people that have received a life-saving medication. And so for us, like, these are the building steps of how we are going to continue to focus and prioritize our approach. Now, the medical director and his team, we met with us as a department, and we are seeing the map, and we need to focus on our concentrated areas. And so what we are planning on doing is expanding who is carrying the medication, specifically Suboxone, on the apparatus, so that instead of waiting for individuals to respond that have that additional skill set, our crews that are on the streets that are engaging with these individuals right outside on the sidewalks in front of the fire stations are going to have this life-saving medication and be able to administer it for those that have either received Narcan post-resuscitation, or those that are trying to kick it on their own and have it used in 20 hours and all of a sudden they're feeling really, really crummy. We have the incredible geographical layout within our city to have hospitals that are within minutes of all of our fire stations, essentially. So oftentimes it's almost more advantageous for someone that's really, really sick. They just want to get to the hospital and have these conversations when they're not feeling well. But I'll turn it over to Dr. Burnett to kind of speak to the expansion of the program and then also what he's seeing on his medical direction team.
Yeah, thank you, Chief. So just to be clear, Narcan is the treatment for respiratory arrest for not breathing. It is not a treatment for substance use disorder. Suboxone is the treatment, the cure for opioid use disorder. And so to the Chief's point, what I see when I'm working in the emergency department, and I worked nights this past weekend and the weekend before, is that when our department encounters these individuals who are in withdrawal, oftentimes it's quicker for them to just get to the hospital and to get the patient the Suboxone quicker by just transporting, because we've had the Suboxone on the supervisor, car 50 or 51's vehicles, not on the individual ambulances. I do feel comfortable telling you that the patients are still getting Suboxone. They're just getting it after hospital arrival. We anticipated we would have more patients refusing to go to the hospital than what we're having, which is reassuring. But in an effort to get the patients feeling better sooner and to sort of build that therapeutic relationship so that they will be amenable to continuing Suboxone, because one dose of Suboxone does not fix the problem. Continual Suboxone fixes the problem. We are going to deploy Suboxone directly on the ambulances that have the highest response rates along the high-use corridor, essentially the green line. We try to be a very data-driven department, so this is a pivot based on the data we've collected that show while we have given it 3 times, we think we can do better. And so we're adjusting our deployment model based off that data. We'll continue to collect data on this, and if we see that this is the solution, this increases our Suboxone administration rates, we will likely put it on all ambulances in the city. It will still be available to every resident in the city by requesting car 50 or 51. The challenge is it is a controlled substance. It does have additional control and custody requirements with it. So we're still approaching this as somewhat of a pilot, but we will be collecting data in real time. And if we see a clear signal that placing it on the ambulances is the right approach, we will expand that to all the ambulances in the city. In the meantime, everyone can feel comfortable that their constituents have access to this medication through requesting car 50 and 51. And like I said, I will assure you, we collect data on this in real time. So I'd be interested in any feedback on that. If we find that that deployment model doesn't work, we will try something else. We are not going to stop just because we have not identified the best path. And I will assure you that we are in constant communication with our partners, both locally, including across the river, as well as nationally. There's probably only around 12 or 15 municipalities in the country that have Suboxone pre-hospital with their EMS services. So we're all still trying to figure out the best way to do this. And so I will commit to you that we will stay in touch with those other departments locally and nationally who are doing this. And as any one of us learn, we kind of share it with everyone else. So I'll also just have you know that the work here in St. Paul with Suboxone is being recognized throughout the county. So the Maplewood Fire Department is going to imminently, within the next week or two, deploy Suboxone. They're a much different department with 4 ambulances on the street at any given time. So they will be deploying it on their ambulances. But this leadership in St. Paul is now extending to the rest of the county. So I think that's a great thing for the broader community. And I just wanted to make you aware of that as well.
That's wonderful. Thanks so much. I have Vice President Kim and then Ms. Johnson and then Ms. Bowie. Did you have a hand?
Yes.
Okay, and we'll go to Ms. Bowie.
Yeah, the only 3 doses definitely perked some ears, but now hearing that it'll be deployed through the pilot feels very reassuring with the 60 individuals that are identified. So it's sort of like we know who they are. If you're responding, you see the familiar face, you understand kind of like what steps are needed. I think the 2 things that I want to lift up from the meeting over a year ago now, when we were, I think, all in the same room listening to the professor at the U of M, was talking about how safe use sites are both like, a good idea, but also like that's not the point. And Suboxone is the thing that we can do to stop the funnel, like stop. It's the filter, it's the medicine, it's the thing that folks need. And so I just want to name that I really, really appreciate, as we've reiterated time and time again when you come here, not just the interest, but the immediate response that we received. And not only that, but a systemic one with partners at the table. And now it sounds like we are using ourselves to help implement other models in other cities for other folks. So it's just, I think, a point of personal pride. But yeah, the original question that I had was around sort of like, what are the alternatives? How's the Suboxone program going? And then initially hearing the 3 doses, I think my ears were like, wait, that doesn't seem right. But very clearly the investment and interest is there, and just a deep gratitude for all the work that you're doing.
Thanks. Ms. Johnson.
Thank you. Yeah, I echo some of the same comments from my colleagues. I think I find myself trying to find ways to put not the previous presentation, but also this presentation together. And being that we are also getting our opioid settlement funds and funding, I guess I'm wondering just like how that relates to the work that you guys are doing. Is this a part of the overall like city response based off of the funding that we are receiving for the settlements? Like, could you explain the tie, if there is any? And then as a follow-up, with the data that's given, do you currently disaggregate it? One of the things I heard from the county presentations is that we are seeing increases in African Americans overdosing in the county, and Native Americans and Indigenous people. And I'm wondering if we have or are currently tracking those numbers as well in the city.
Council President, Council Member, thank you for the question. On the data tracking piece, we do collect that information, but it's essentially reactive. It's after the engagement, when we engage with the patients specifically as a patient. So we do have the ability to collect those kind of demographical data points. However, we also engage with the community when we're at the grocery store, or we have people that walk up to the fire station requesting the Narcan leave behind kits, the fentanyl test strips. We have the ability to hand those out like 0 questions, and we don't, and by policy, we were not like tracking that per se to kind of ease any, ease the ability to get it into the hands of those that need it most. So there is the reactive side, but not the proactive side of what we're doing as far as getting that in there. So it's kind of a yes, but response to your question. And then the first part of your question, ma'am, would you mind?
Yeah, so how is this work funded? Is it funded through the settlement funding, or where is the funding currently coming from that? And then I guess separately, Ramsey County's presentation kind of touched a little bit on their work that they're doing with their resources that they're getting. And I don't know what the prompt was necessarily for this presentation, but I am curious as to how maybe this work and the Suboxone work actually ties into the increased funding that we are receiving from the settlements.
Sure. I can speak kind of loosely to the opioid crisis is one of the major priorities coming out of the mayor's office, as you are all aware. And so there is the standing up of a program that's really going to focus on this. And I kind of hit on the right, like recognition that we have an issue and being able to present that information to the community. We also have how we are going to engage with those that are suffering from it, and then also the enforcement side, because we know that just as there are people that are suffering on the use side or the addiction side, there are those that are preying on them. So it is going to be a collaboration across all departments because, again, we don't know a single department that's not impacted by this at some level. And that group's going to compile and come together. And that's why I'm grateful that Director Shute is here because he's really helping kind of drive this forward and the collaboration between the principals from the different departments as well as the tech side of things. And the ability to kind of have a dashboard that's out there that anyone can gather access to that essentially will layer all these different data points into a single source that will be a benefit to not only our residents within the community, but certainly you as council members. So those are a couple different pieces. Now the funding itself, I know all the Narcan that we have incurred within or utilized or purchased within the City of St. Paul Fire Department, we've gotten reimbursement through a state grant. And so that's been massively beneficial to kind of influx and offset some of the costs of what we're seeing. But as far as some of the other fundings, I would have to defer to another authority on that.
Thanks for the question, Ms. Johnson. And I will just follow up by saying that as we do approach our budget season, obviously 3 doses of Suboxone, I think it's $6 per dose or something. It was not breaking the bank. So that $18 probably isn't, I'm sure someone has found it somewhere. But as the pilot expands, I have exactly the same questions about how much it will start to cost and how we can keep that going, either from the city settlement dollars or from some other source if those for some reason aren't appropriate uses, which can't imagine that those wouldn't be the appropriate source. So we'll come back to that as we get towards our budget season. And again, to Ms. Johnson's question, we will have our city budget folks come and talk to us about our use of our opioid settlement dollars. But Ms. Bowie, and then I think we'll wrap it up with that.
Thank you. Yeah, I think I look forward to, thank you, Council President, for further conversation around just like the tangibles around how much is this costing, whether it's per dose or also staffing wise. I just wanted to ask a question because I know when I was at the station having a conversation with the firefighters, I didn't get the response back, particularly around our partnerships with our hospitals and our clinics, and is that something that is determined based off the city? I was wondering in terms of what are the agreements of if someone is picked up and they need to go to the hospital, do we have the opportunity to expand what our relationships with treatment centers are, even having a mapping of where our treatments, because I know especially with the federal cuts, we've been seeing a lot of closures of not only housing, but some of those treatment centers. So I'm just curious of the range of relationships that we have with the hospitals. I know Regions, I believe, is our designated one, but if there's any other ones, and then also with treatment centers.
Yeah, thank you, if you don't mind, Chief. So for patients who are transported to the hospital at the fire department level, we rely on the hospital to coordinate those follow-up plans. But we have developed for the fire department, really targeted for those patients who don't want to be transported to the hospital, a referral sheet that I'm sure we can share with you. And we developed that after meeting with the Steve Rumler Hope Foundation and the Twin Cities Harm Reduction Group. Those are two groups we're planning to present this sort of same data overview and everything to in the near future. The Twin Cities Harm Reduction Group specifically was very helpful. They had dozens and dozens of representatives from both public and private treatment centers throughout the Twin Cities who offered their name as a referral source that, again, patients who don't want to go to the hospital could kind of cold call the next day. We also include Clinic 555 and Ramsey County Detox. So we can share that sheet with you, and we're always looking to update it. It's sort of a live document. But again, that was really designed for those patients who don't want to go because, again, we're not forcing patients to go to the hospital. The thing we're very cognizant of is we don't want people to lose trust in the healthcare system, to lose trust in the fire department. So we want people to know that if they call 911, we will meet them where we're at. We will offer them Suboxone. We will offer them transport to the hospital, but we're not going to force that on them. They retain their autonomy and their decision making. But if that is their choice, that they don't want to go to the hospital, we at least have Narcan leave-behind kits we can give them. We have a referral to Suboxone clinics we can give them. What we can't do is give them actual Suboxone, and that comes from the Board of Pharmacy. They feel that that is dispensing medication, and so paramedics cannot do that. There's Steve's law, the specific law around Narcan, which allows us to leave them Narcan take-behind kits, but the Board of Pharmacy has given us an opinion that we can't leave other medications, any other medication with them. But we'd be happy to share that document with you. Please circulate that with your constituents if they have ideas of other places we should add. Like I said, it's a living document that we're always updating.
And if I may, I mean, that is a major component, the follow-up piece, because we will engage with someone, whether, we're administering Narcan or they've had that, or again, they're not feeling well, but we're not forcing them to take Suboxone. Like, they have to be at the point where they're ready to accept the medication or accept the resources. And that follow-up piece, whether, it's a lack of available clinics, if you will, or resources that are out in the community, like the follow-up piece is what is, I feel like, probably the next generation of this program specifically to the fire department. So we really think that we can bake this into like a community paramedic approach where our crews that are out on the streets engage with a certain individual, and then we have the ability to follow up with them. It's all under the continuum of care, and we're still protecting anything that is, PHI or HIPAA related, if you will. So I think that is a massive kind of step in what we would look like in the future. And, that's tied into essentially the CDC grant, that's tied into some special legislative funding requests through the Ramsey County Attorney's Office that we supplied additional information. And again, that's kind of probably the next phase of this program beyond the expansion of who's going to be carrying the medication itself.
Well, thank you so much for that response, and I think it's fortuitous, although not accidental, that Director Karen and Deputy Director Frank are in the room, because it does strike me that you are literally the first response, and then Ramsey County Public Health and your systemic, longer-term, and collaborative approach, which we really appreciate, could really be that next phase of the work. So I hope that you keep the conversation going after this. I'm sure you've already started it. Sorry we went a little bit over time. Thanks to my colleagues for your understanding. Thank you so much for the work you're doing. We can't wait to hear the next update, and we, again, appreciate you acting with urgency, as the Vice President said, and showing that we can move swiftly when there is a crisis. So thanks so much.
Council President, council members, thank you very much for the opportunity.
With that, we are adjourned.